Joseph Sadek. I am a professor of psychiatry at Dalhousie University, and I have been involved with the judiciary since 2016. I'm also the chair of education in the Canadian Psychiatric Association. I'd like to talk to you today about the importance of mental health in judicial effectiveness. The well-being involves individual well-being. It also involves relational well-being, how we get along with our colleagues and with others, and finally also the organizational or system well-being. Why mental health is important for overall health? For many reasons. About 14% of the global burden of disease has been attributed to psychiatric disorder, mostly due to chronically disabling nature of depression and other mental disorders, such as alcohol use, substance use, psychotic disorders. And mental disorders increase risk of physical disorders. We know, for example, that depression increases risk of several types of physical health problems, such as stroke, heart diseases, and diabetes. And it's a highly prevalent. 1 in 5 of adults live with mental illness. The ability of the judiciary to fill their mission and perform their function is based on public trust and confidence. In large part, the judiciary members earn that trust and confidence by faithfully performing their duties, adhering to ethical standards, and effectively carrying out internal oversight, governance, and responsibilities. If a member of the judiciary fails to pay attention to their well-being, what will happen? Their ability to effectively perform their duties may be altered. This may impact their public trust and confidence in the judiciary and its decision as a whole. So we are really into a very important issue, which is well-being and mental health. As you know, the Narrow Declaration had 7 pillars, and one of them was creating awareness, prevention, and management of mental illness. And the awareness piece is what I want to talk to you about. So what are the common mental health problems that could impact us? The first problem is burnout and stress. And prolonged response to chronic stress on the job can produce symptoms of burnout and stress. What do people experience when they are burned out and stressed? Number one, exhaustion. I feel I'm completely tired, I'm exhausted, I can't do my job. The second piece is detachment, feeling detached from my family, from my friends. People can sense that I am detached. And the last category has to do with sense of ineffectiveness and lack of accomplishment. So I could be very well accomplished, but I feel I have done nothing in my career. I am useless, and that sense can be quite strong when I'm burnt out and stressed. Stress has a lot of physical symptoms, could also be leading to other disorders, other comorbid disorders like alcohol or substance, a lot of physical symptoms, a lot of cognitive symptoms, and other physical manifestations. So stress is one area where we really need to recognize, prevent, and manage. So that's area number one, which is burnout and stress. The second area, which is called adjustment problem. So if I am faced with a major stressor in my life, sometimes I develop a response that's more than what's expected for these type of stressors. And that could lead me that I can't function. I can't function socially, I can't function at work, I can't function academically. And that would be called an adjustment disorder. Adjustment disorder to major stressors happen within the acute kind of, adjustment disorder happen within 3 months of the onset of the stressor. We could have a adjustment disorder with depressed mood, with anxiety and depressed mood, with disturbance of conduct. So I start, yelling, throwing things, disturbance of emotions and conduct. And that would be the second problem, which is called adjustment disorder. The third problem, which is highly prevalent and very important, which is anxiety. So we have something called generalized anxiety disorder. What is generalized anxiety disorder? Generalized anxiety disorder is, number one, excessive worries. I worry about so many things. I ask people, what do you worry about? They tell me I worry about everything. The second piece, which is I can't control my anxiety. So it keeps coming back. So whatever worries I have keep coming back. It has to persist for at least 6 months, and we have to have 3 out of 6 symptoms. I'll tell you what are the 6 symptoms that happen with anxiety. First one is muscle tension. Second one is concentration problem. So for muscle tension, I feel like my back hurts, my neck hurts. The second problem is poor concentration. Next one is irritability. I start snapping at people. I start getting angry easily. Then poor sleep. Either I can't sleep at night, I can't go to sleep, or I wake up in the middle of the night, or I wake up early in the morning. So some disturbance of my sleep. Restlessness, I'm always fidgeting, biting my nails, tapping, And lack of energy. I wake up tired. I feel tired a lot of the time. You only need 3 out of those 6 symptoms, and that's called generalized anxiety disorder. I want to remind you that after COVID, we started seeing a lot more anxiety that spread with the fear of COVID and what happened during COVID. Anxiety can be very disabling. You could also start having panic attacks and worrying about different panic attacks, which go into a different category. Anxiety can affect your social functioning, your academic functioning, your work functioning. And the management is simply, could be through medication, pharmacotherapy, or psychotherapy, or both. The next category, which is quite important, is post-traumatic stress disorder. And in the past, we used to think that you have to witness a trauma yourself and live through this event. But now with DSM-5, we have a category that describes an issue that can be very problematic for people who deal with daily trauma. Like it's about experiencing or repeated exposure to events and just hearing about it. So a police officer who sees, multiple murders frequently, a judge who listens to graphic details of murder every day, and that could be one of the definitions of trauma. So now this is really important. So what happens with the trauma? There are several categories of trauma, and I just want to, explain to you the categories just briefly, and I'm not going to get into each symptom. But the first category is kind of re-experiencing the trauma, which could be like a flashback, could be dreams, could be other things. Okay. It also, there is a category of avoidance. So I know this has happened in this place, I try to avoid that place. I go into a different direction. If it was a fire, I avoid the smell of burnt toast because that triggers my trauma. And there is a third category, which is alteration in cognition and mood. So I could, have persistent feelings that things are not good. I start feeling detached. I have no one can be trusted. I have these kind of feelings. And finally, I have the category of arousal and reactivity. So, it could be an angry outburst, could be self-destructive behavior, it could be startle response, it could be sleep problems, it could be hypervigilance. And so those are the common categories of PTSD. And I just wanted to create awareness that those are the categories, and that is a very important disorder in psychiatry. Next one is something very important as well, which is depression. And I think depression is highly prevalent. We know that at least 1 in 5 had depression. You either have to have low mood or loss of interest and pleasure. So people used to enjoy going for a walk, used to enjoy watching a movie. They don't enjoy it anymore. Just nothing really brings them joy. This is called anhedonia. Or low mood, where my mood between, like, say I ask someone between 0 and 10, 0 sad and 10 happy, where was your mood? And they say my mood is 1, 2, very low, very depressed. In addition to that, you could have appetite change. So loss of appetite, or sometimes the opposite, increased appetite. Poor sleep, or the opposite, increased sleep. More commonly, poor appetite, and more commonly, lack of sleep. Poor concentration, I can't focus, I can't do my job, I can't concentrate. Then guilt, and guilt can become very problematic because I start feeling guilty of things I probably sometimes I shouldn't feel guilty about. And low energy, I'm always tired. And sometimes I get agitated, or I'm very slowed down, that I feel like I'm in a slow motion. And finally, my biggest worry in depression is the suicidal thought. So how does it start? It starts with like, I wish, I wish I wasn't here. And then maybe it's better if I sleep and I don't wake up tomorrow. And then starts becoming more ideas and more plans. I actually don't want to be here. The person starts having intent that they don't want to be here, and how they are going to do it, and they start planning their suicide. And that's where things can be very difficult, because we have a rate of around 15% that actually complete suicide. Depression, when it's severe, could also come with something called psychotic features. So I could start hearing voices telling me, go jump off the bridge or go kill yourself. It also could have catatonic features, which I become either so immobilized or very, very active. The psychosis can be very problematic because the voices sometimes give commands, and that's in severe depression. But we do have treatment for depression. The severe depression can be highly treatable. Any type of depression is treatable. We just need to recognize it and seek help and get it treated. I hope I just opened the door for few of the disorder, and I think we will continue this cycle with few more psychiatric disorder and maybe how to manage them after recognizing them and how to deal with them. Thank you very much for listening.